Joining me this morning here in the studio is Mr. Posh of indiGO, your allies for independence. Good morning, sir.
Good morning.
How are you doing?
I'm absolutely wonderful. How about you?
It's powwow time, and there's little stresses. I've done audio and video stuff for powwow for the past 4 years, I think it's been. Every year it's a love hate relationship. I love the powwow, I love everything it does, but coming up with some of the technical stuff, audio and live stream video, there's some stresses to it. And of course, if anything goes wrong, there's pressure to get stuff up and running. So, anyways, that's what I'm dealing with this week. I'm excited for the powwow. Start, actually starting tonight at 5 o'clock with royalty pack. Anyways, enough of that. Enough of that. Let's talk about what indiGO is up to and what you're up to. What do you have on your agenda?
Well, I want to start with this. I ran across a couple of these articles in Wisconsin's Rural Reporter, which comes from the University of Wisconsin. And this one, get everybody's attention. Unpaid medical bills lead to rejection of services. Allina Health System, which runs more than 100 hospitals and clinics in Minnesota and Wisconsin and brings in $4 billion a year in revenue, sometimes rejects patients who are deep in debt, according to internal documents and interviews with doctors, nurses, and patients. Although Allina's hospitals will treat anyone in emergency rooms, other services can be cut off for indebted patients, including children and those with chronic illnesses like diabetes and depression. Patients aren't allowed back until they pay their debt entirely.
Wow.
Allina has an explicit policy to cancel appointments for patients with at least $4,500 of unpaid debt.
Wow.
Just bringing it to people's attention.
Wow.
Yeah,
that's Allina, so that's not Essentia,
right?
Which is represented here in Wisconsin a lot.
Mm-hmm.
Wow.
I'm not that familiar with that hospital system as well. You know, we do have Essentia in this area, and there's some Marshfield
clinics.
Yeah. So I'm not sure. I haven't really heard much about them, but that's not a good thing to hear about anybody.
So what can people do on that?
That's out of my purview.
Yeah.
I really don't know. I'm just bringing it to people's attention so that they're aware that, hey, if one hospital starts it, well, another one,
the other ones follow suit.
Yeah.
Wow. I know in my own personal situation, again, I have some lots of medical debt because I've had several surgeries in different parts of my body, and you still have to go to the doctor at the same clinic from the same hospital metropolis. And I guess if you're making payments of some sort on your hospital bills, you would think that they would say, okay, you're making the effort. You're not just stonewalling them and not paying anything whatsoever, that they might have a little leeway with that. But again, who knows?
Who knows? The main thing is the bottom line. This is America again.
Right.
So here's another one that's kind of interesting. Came from the same rural reporter. More than 9 million American adults aren't taking their medications as prescribed due to the cost. With those who are uninsured or disabled among the likeliest to cut corners, according to new CDC data released. Why it matters: skipping doses, taking less than the prescribed amount, or delaying refills to save money can make health conditions worse and more expensive to manage. And what they found: income, insurance, and disability status were among the biggest determinants of whether a person misused drugs as a cost-saving strategy in 2021, per the CDC report, which focused on retail prices and medication adherence. So Between the lines, while the average prescription price didn't change between 2020 and 2021, out of pocket spending for prescription medications jumped 4.8% to 63 billion in the second year of the pandemic. So, that's so I just, it's hard to even imagine an elder, somebody cutting back on something they need because they can't afford it.
Right. Yeah.
And we're still dealing with a broken medical system.
Yeah. Yeah.
All right,
Yeah.
something on a lighter note. I don't want to go too deep into that one because I'll just
Right.
get angry, and I'm sure that hearing it makes people
again,
angry as well.
Personal experience, there is a medication that I get that's $75 for a month's worth of medication. And sometimes I don't need it. Thankfully, I don't need it all the time. It's kind of take it as I need it. But $75 for 30 days, worth of prescription, that takes a chunk. And then I even noticed that grocery prices are going up. What I used to buy at the store, even a few months ago, the prices of that stuff is going up. Of course, gasoline's going up again. So here we go again with the roller coaster ride of inflation and stagnation, and it's just it does make it difficult.
And those people on Social Security aren't getting ample amounts of increases to keep up with those.
It doesn't change with that as it goes. It it gets reviewed like what, every 5 years or something, or is it more often than that?
I'm not sure how often they do that, but you just seeing what people are getting for Social Security payments when they retire is it's not enough to really sustain you.
No.
So any kind of cost increase once you retire and your income is set due to your Social Security and whatever investments you might have made, that's it. So as things go up, are you going to get those increases? And generally, if it's coming out of the government, they don't want anything to come back to the people. There's other people that lobby against that.
Yep.
So let's go to something else.
All right, let's go to something.
All right. There's an event coming up in Sawyer County and Hayward. We Care Sawyer County Walk and Roll 2023. And this is to bring attention to the caregiver shortage.
Okay.
And this will be coming up on, let's see, where's the date on here? August 5th, 9 a.m. in the Slumberland parking lot on Highway 63 in Hayward. And they are just looking for people to attend. They're looking for people that would like to bring attention to this and see if we could maybe match up some needs with people that are willing to provide them. Caregiving isn't just the physical caring of a person. There's also what happens when you can't cut your firewood anymore. Right. You can't start that chainsaw or start the lawnmower. Sometimes little tasks like that, maybe some errands that people need run, that's really that is caregiving as well. So they're going to try to bring attention to this and see if we can maybe hook some people up with some resources at that event.
Okay.
All right. And I did hear you mention the broadband.
Yes. There's a survey going out now. And again, I've heard of this because I work with the Sawyer County Economic Development Corporation and the Sawyer County Administrator. And they're doing this survey because, again, the state of Wisconsin and the federal government is funding this through the state, and then it trickles down to each county. There is support funding for the improvement to broadband, but we're really looking for a picture of where everything is at right now, so then we can measure the improvements that are being funded to internet providers to expand broadband access. I've explained to people, a lot of these broadband companies um, will, expand into areas where there's population.
The low hanging fruit.
Right, but where there's a large gap between those population centers, they're not necessarily willing to extend their fiber. Basically, they're just laying down fiber because of the cost of that fiber per foot or per mile, however they measure it. There's no income in that space between those larger communities. So they're not really interested in expanding that. So the federal government is providing funding into the states, and the states then bring it to those providers to say, hey, we will help fund the cost of connecting those population centers together with fiber, and then you can provide the services. Long story short, there it is. So now they want to kind of see what's happening in currently, what's happening with your internet service, what the quality is, what the speed is, how much it's costing, and then, of course, any complaints, which I would assume there's a lot of complaints about the service of internet services in not just in Hayward or Sawyer County, but several of the rural counties here in Northwest Wisconsin. Right?
Absolutely.
Does that give a good summary of it?
Yeah, it does. And recently I attended a meeting with the Public Service Commission and the 8 independent living centers to find out how the broadband is affecting the disability community. Mm-hmm. And I would encourage people to take this survey, because the more input that comes in, and how long does it take to take a quick little survey, like a 5-minute questionnaire, and you're done? But that input helps, and the louder people are in a certain area, the more likely they are to get some funding to get something done.
Right. Yep. Squeaky wheel.
Well, it's that we're going to be talking about advocacy, and this is an opportunity where the government is asking the constituents, what do they need? So please take part in this. And one of the things that we did find is that, during the meeting, I don't know how many times I've run across somebody that's kind of elder or tech, not interested in technology, to be very proud to say, I don't even know how to turn one of those on.
Right. Yeah.
And that is a barrier that needs to be overcome, because there's so many benefits for elders and people that are not interested in it that they're not realizing. If you live in the middle of nowhere, which a lot of us do, mm-hmm. as somebody from the city would say, well, you live in the middle of the nowhere. Yep. So you often don't have access to things that others do. You might be able to go buy a fishing reel here in town, but is it the one that you want? So you take a drive into town and you're looking for a specific fishing reel, just to use that as an example. Well, they have fishing reels, but they don't have, I want a micro fishing reel, or I want a musky fishing reel, or I want it to have these specifications because this is the type of fish that I'm going to fish for.
Right.
And the stores can only stock so much. Yep. And they have other items that they're dealing with. But on the internet, you could go through hundreds and hundreds of them, pick out the one that you feel is best for you, and have it delivered to your house so you don't even have to leave.
Right.
And and then you got telehealth. You have other things mm-hmm. that where it could come in handy for you. Maybe recipes, things like that. Right. Somebody says, well, I planted arugula. What's that? Well, you look it up on the internet, and there it is. What do you do with it? Do you put it in your salad? Do you cook it? Can you use the greens from your beets after you go to the farmer's market? There's a lot of stuff on there that is so helpful and answers your questions. And the other end I was thinking of is, since we switched to digital, the difficulty with getting a television signal. First, you bought the converter box, which was a piece of junk that didn't work. Then you're making adjustments to your antenna, but your antenna wasn't designed for digital. It was designed for analog. Then somebody gives you another antenna and you say, well, this one's bigger. Maybe this will work. And the money that we spent on trying to get a television signal was unbelievable.
Yeah.
And then on top of that, you still got signals that fade. I go to my dad's place down in the Dells area, and you'll be watching a show and it just leaves for a while, or you're getting to the end of the movie and it just goes off and no signal. So that's quite frustrating. So who ended up having the higher burden is rural people that still want to watch TV, are paying for cable, or they're paying for satellite services. Well, you could stream television shows through the internet.
Yep.
That way, the money that you're spending on that on your satellite can be devoted to the internet. Cut off the satellite, get the shows you want, get rid of maybe 700 of the 1,000 channels that you really don't ever watch.
Right.
And kind of narrow it down to make it easier for yourself without spending any extra money. But then there were issues like the cost of the equipment to begin with and training. So those kind of things were brought up at the meeting as to make the training to use the internet not so scary and take that stigma away that, oh, your ID could get, they're after you. They're gonna get you. And
Someone's
there's a lot of fear there.
There's scammers out there. There's data stealers, and how do you protect yourself? Those are the issues that I know.
Yeah.
Seniors don't understand the stuff. I had a relative that got scammed again with somebody calling them on the phone, and they said, well, you owe this money, and we're going to send the police to you and get you arrested. And they got all worried, and what do I do? Well, you need to go to Walmart and buy, $500 in gift cards, and then take pictures of the gift cards and send them to me. And then, and it's like, whoa, wait a minute. We would, you and I would say that's a scam right away. If they wanted a payment for something that they're going to call the police on in gift cards, that's a red flag right there. It's like, no. So again, example of online scammers that happen because you get an email that says you are going to get arrested if you don't pay this amount online. It's crazy what's available out there.
That's true. So let's I guess the one thing is I did talk about maybe having a PSA made, something so that people could understand, maybe learn that those benefits are going to outweigh that possibility of the scam.
Yeah.
So, and really, you could have things delivered to you. And if you're in, once again, fixing, I had my vacuum cleaner died. I took my tester, found out where the problem was, and ordered the switch for like $5, and I put the switch in and saved myself the cost of buying a new vacuum.
Right. Yeah.
So we're gonna have to move on here quick.
Yes.
We got the ADA celebration coming up at Northwood Technical College on July 26th. We're going to be hosting the ADA anniversary celebration at Superior campus of Northwood Technical College from 11 a.m. to 3 p.m. This is our second year creating a new form of our much loved Empowerment Expo, which will again have vendors from various organizations. In fact, if you're interested in being a vendor, there's still time to sign up. This new event celebrating 33 years of the ADA will be one you will want to be part of. In addition to amazing vendors who will have ADA resources, a historical ADA PowerPoint, a keynote speaker, our very own Russ Stover, entertainment, and more. So there's going to be a raffle, and there's going to be some balloon people out there doing the balloon animals and stuff like that. I'll be out there looking forward to going and meeting people out there and letting people know what kind of what our resources are within indiGO. So,
and some people can just learn, the basic benefits of what the American Disabilities Act provided to American people. not just those with permanent disabilities, but as I've learned with some of my health issues, I have had temporary disability issues. And I challenged some of the ADA things that our local businesses had going on. And it's like, no, no, this should be corrected so that a disabled person can have the right to access the store as anybody else can. And those are real simple things that most of us able-bodied people never really think of, especially
I'll
like
take it for granted
right.
until it happens to you. You get in a car accident, you break a leg, you slip on the ice.
Yeah,
All of a sudden, you're not getting around so well,
you're
and
in a
maybe you're using a
wheelchair
walker.
or walker or wheelchair.
Yeah,
Yeah,
it is a big deal. It's a lot more when you're the issue of it.
yeah,
Watching somebody else be that issue is way different. And one of the
yeah.
things I wanted to talk about with the ADA is what it took to get it passed. There's a
Oh,
lot of advocacy, and I want to talk. I want to really highlight the advocacy because it was passed in 1990, but this advocacy started back in the 70s. So it took a long time and a lot
yeah.
of people. There isn't just one hero of passing the ADA. It took lots of people
Mm,
to create the awareness
right.
that this was going on and that some people were being severely discriminated against.
Yeah.
And it is so easy to be an advocate. You think even back the 8-hour workday, those people that went on strike and fought, the unions that fought to get the 8-hour workday, paid time off, which that's a hard one to get still.
Yeah.
Family leave, those are some labor issues that are still in the works. And right now there's been talk about raising the retirement age for Social Security up to 70 years old. They just raised it not that long ago to 67. Well, that comes from a lot of people that aren't physical laborers. A lot of times your body is, if you're pounding nails or whatever physical labor you do, whatever that job is, after a certain point, your body starts to reject doing that
Right.
kind of work.
Yeah.
And I'm sure that a congressman can sit on their ass and flip their lips and talk all day long, without really breaking a sweat.
Yeah.
But a lot of us work really hard and put our bodies through a lot, and we can't wait till we're 70 to retire.
Sure. Yeah.
So,
Or to receive the benefits of retirement, of early retirement,
yeah,
or disability. When someone's body totally quits and you have to go on disability, which is an early form of Social Security benefits, it's sometimes not enough, and
it's mostly never enough.
yeah,
It's almost like a barely existing amount for people because it's once again, it's limited. You have no way to increase that unless maybe you still have some abilities left that you can work part-time.
right. Yeah.
But it works easier if you're in the city. You could get a part-time job because there's so many available. Jobs in our rural areas are not the same.
And getting to those jobs takes a little more planning, but we do have a version of public transportation. But like you said, in the urban areas where there's more jobs to it, public transportation is easy. But out here in the middle of nowhere, it takes a little more planning, and it's available, but yeah, it does take more logistical planning on how you're going to get to work, how you're going to get home.
And it's not free.
Yeah,
it's not going to work isn't free. You're spending money every time you get in that vehicle and go to work, make your lunch before you go, or buy your lunch when you're out.
Yeah.
So one thing I'd like to quick talk about is advocacy, being that how easy it is to become an advocate. One thing you got to do is learn who your representatives are. So if it's a state or a federal issue. So let's just take Social Security, for example. So you would be, most of the people in our listening area will be contacting Tom Tiffany as their their U.S. representative,
Yep.
and Tammy Baldwin and Ron Johnson. They are the ones that you're going to talk about for federal issues for that federal program, and be respectful.
Mm-hmm.
And one thing that I think is kind of cool, a lot of people, it's way better to contact them and vent your feelings than yell at the TV when they're talking about these issues, or bring it up on Facebook without any real facts.
Yeah.
Now, let's say you send an email to your congressperson, and you shouldn't say, well, they're of the opposite party, I don't want to talk to them. No, they're your representative. You are paying their salary, whether they're from the opposite party or think differently than you do. They're still working for you. So make them work. So the one thing, they count how many times an issue has come up from constituent complaints or contacts. So numbers matter. And let's say you say, well, I want Social Security to be kept where it is with some increases in the future. You make up this respectful letter, and you either send a handwritten letter or an email. Then you get a response. That's when you go to Facebook. Here's my letter. Here's what they had to say.
Sure.
And that can generate more advocacy. It's like, they answered that to your question.
Mm-hmm.
Now I'm upset. I'm going to call
them.
Yeah. So it's
kind of that grassroots beginning of how to build up, some advocacy groups. It's very simple. Like you said, it's a simple email. It's a simple phone call. They do keep track of how many times you call or an email comes in, like you said, on a particular topic. And it helps. And especially if you get a response and it's not to your liking, send another letter.
Exactly. And share it. That's the kind of stuff you want to share.
Because that helps keep the conversation going. Whether it's not the conversation you want it to be, make it what you want it to be by continuing to advocate for yourself and for your fellow constituents by sending it again or sending something a little different. And, try to make contact with these representatives in a very personal way, not by trashing them,
right?
But saying, hey, can you help us out here? This is what we need. Here's where we're going. Don't raise the age limit on Social Security, because for me, I'll never retire if they keep raising it, because I'm chasing that age limit.
They've already changed it for both of us
right.
from 65 to 67. So we fall in that age category where we have to work longer already. Now they want to work us
do it
to work
again.
Even. Yeah. So that's and really it is so easy to be an advocate, and you should use this practice with all of those types of issues, and you might be, who knows, it might lead to a career for some people.
Yeah,
it does.
Yeah.
There's grants out there for advocating for certain issues, and hopefully we could get some new grassroots organizers to make a dent in this situation that we're looking at with Social Security.
Sure.
And with Medicare.
Yeah. Wow. Lots of stuff to talk about and unpack, and we can't do it now anymore because we got a minute left. But I want to give people your information because I want them to be contacting you. Don Posh, he is an independent living specialist for Burnett, Washburn, Sawyer, and Price counties, and he is available. I'll give them your cell number because that's probably the easiest. I know you travel a lot and you're not in the office all the time. 715-919-4932. You can also email Don at indigo, indigo.wi.org. Don at indigowi.org. And thank you so much for coming in. We'll have to plan more time for the next time you come in next month.
Seems like we ran out. We do really good at
and we should. I would like to
forward.
actually add phone calls into that mix at some point. Talk to the audience.
I think we're going to need